So when one thinks about genomic medicine, you're highlighting three interrelated but distinct technologies. One is gene therapy, where its goal is to replace a defective gene related to a specific disorder. Are these therapies durable, meaning a one-time treatment will address, or will you need to have multiple therapies when you think about gene therapy?
A lot of it, depending on when I tend to look at cancer a lot, because that's what we've obviously used genomics for the most.
Yeah.
They tend to be ongoing treatments, because cancer is kind of an age-related problem. So when you say someone's predisposed to a disease, they may not have an issue until they're 60 or 70. And then that gene triggers and they start having an issue. So whatever you're doing to stop that gene from expressing itself, you're going to keep doing. The goal is to get to where you're using it, there's low-cost solutions.
So it's not a one-time, but sometimes you may have to take multiple bites at the apple to
Yeah, it's going to be a lot. It's going to be a lot like a lot of treatments today, where the best is compared to like statins. So if you've got cholesterol, you're taking statins for the rest of your life, and don't want to digress too much, but a perfect example of when you're looking at sequencing, statins only work on about 60% of the population. So there's 40% that are just prescribed that doesn't work at all. In fact, it might even cause adverse effects. We can tell from the genomic markers who it's going to work on. And they don't use that today. Because they look at it and say, well, it's $10 a month, what's the problem? You should never be taking something that doesn't do anything for you.
Is it toxic, some of these drugs?
This is for...
or is it just benign, just not effective?
Some of them are benign, but anything that's going into your body's going to know what to do with it. So there are, adverse effects to every medication.
So it's only $10 a month. So I mean, if there's because to me, precision medicine's worth it. And if you can be more precise in what you're doing and more intelligent, it seems to me that would be the normal course you'd want to take.
Exactly. When you look at the commercial on TV with all disclaimers, imagine eliminating all the disclaimers, because you only prescribe it to who it works on.